And that's so funny about being able to speed up if
Yes.
if you're
Yeah,
getting
I
bored
never
watching
thought
it.
about it
Okay, Monica,
actually.
don't speed this up, even though we know you can think faster than we can talk.
Yes, yes.
And actually, the nice thing about you recording, Linda, is I don't need to see the transcription, which I do find distracting because I've been
Yeah, it's true.
recording a few meetings lately, and it's like, oh, okay, now, yeah. Anyway, um, but yeah, so well, Liliana and I have done a few um presentations with like outside organizations in the county that have been interested in our work with health and racial equity. So we've had like a pre-existing PowerPoint for a while, and then we've kind of have updated it based on the meeting that we're doing. And so we did a version of it for this onboarding, and we did this similar or the same presentation, I guess, back towards the end of April with Leo Moreno from Strategic Initiatives, and then Emma Wolf from Trauma Informed, because they're the other two newer members of this team now that it's part of CHSI. Um, so anyway, yeah, so they must have started, I don't know, March or something on the team, something like that. Um, anyway, I'll just pull up the PowerPoint. It's not too long. I think when we did this with them, I don't think it took an hour, so that's a good thing, especially late in the afternoon. And actually, this will be somewhat of a review, but that's not really a bad thing either, because you might notice some of this from the presentation we did at the June 7 CHSI meeting, where where it was all about health and racial equity. So anyway,
Glad to have a review.
yeah, I know that doesn't hurt. Let me.
Just to clarify, Maya and Liliana, you not being
Yeah.
here in September, is that temporary? Are you going somewhere?
Well, maybe we should explain all that. No, we're basically transitioning off the team.
Okay.
Yeah.
So yeah, I guess, yes. So there's been a lot of changes with this team. Well, so this we'll get into this more from these slides, but so this health and racial equity team, it originally just started with health promotion, and it's been going since like 2017.
Hmm.
And so most of us have been the current members the team have been on since 2017. So it was just kind of like a long-standing
Mm-hmm.
team. And then just in the past year, we've been transitioning to more of a broader CHSI health and racial equity team meeting. So it includes strategic initiatives, which is like Leo, Hannah Young, Jen O'Brien is the manager of strategic initiative. What else? Trauma informed. So that's Emma Wolf. That's part of CHSI. Who else? Chip, I guess.
Mm-hmm.
Yeah, with
Karen.
Karen Nicolai, or yeah, she'll be
Mm-hmm.
retiring. But so yeah, so it's been a year of change as far as, so with that transition, Leo and Emma started on this team, and then I think it was Abby that had suggested that we come up with a membership plan, because we never had one. So we kind of just like, this team just started back in 2017, and wasn't until a year or two ago that it was like, oh yeah, maybe it's time to get, um, get some fresh eyes in this group, get some new people on, especially because we have a lot of new people now in health promotion. And, then the rest of us, would transition off. So, the other long-standing members of this team, besides Liliana and I, have been Kathy Rude, Diane, Ruth, and yeah, there were some other people, but then some people retired or left health promotions. So anyway, so Kathy and Ruth kind of transitioned away after this past June. So they're not going to be coming to the meetings anymore. And then Abby has been like our M team rep on the team, and she's going to stay on. So, and then Diane's going to transition off after the August meeting. And then Liliana and I will kind of stagger our transitioning off. So if that makes sense. So a lot of changes, but
Yeah,
okay.
thanks for the rundown.
Yeah, it's taken a long time. I think it's been like a year that we've been going, like, kind of working on this membership plan and how to do things, because it's just been so many of us have just been on it for so long, so it's just kind of taken a while to kind of figure out the best way to go about it. We all kind of wanted to stay on through that June 7 meeting, because that took a lot of planning, that CHSI all staff training. So we thought, let's all stay on at least through that, and then
Smart and cool that you all took the time to do the transition plan, because membership can be funky. I had a similar experience with the farm to school team, and it was like, we're all the same faces. We got to not do that. So
kind of mix it up a bit. Yeah. And it was funny, before Abby brought it up, it was like, oh yeah, like somehow that had not come up. But I think the first few years it was kind of a heavier lift, where we were just, because nothing like this had really been done before in health promotion, or even so much in the public health department, as far as so much of a health and racial equity focus. So I think we were just kind of focused on getting things going the first few years. We didn't really think about, well, how long are we going to stay on, or so
yeah.
um yeah, no, that's a very good question. um oh, let me get this started. So anyway, here's us. I realized maybe we didn't really have a lot of time to update this PowerPoint, because we just realized this week that we would have this onboarding meeting with you guys this week. So anyway, it might be a little choppy running through it, but I don't know if you've seen this image before. There's other ones kind of similar. Sometimes you'll see like one with what is the one where people are standing on like different heights of stools, I think, like trying to see over a fence. Is that another one? Just kind of getting at the difference, like what are the differences between equality versus equity? I think it took me a while to kind of wrap my head around, you know, like what this means, but we always like to include this image. I think if I updated the PowerPoint later, it'd maybe be to have a slide talking about what this image means. But I'm sure this isn't the first time you've probably seen a similar image. So anyway, what we'll talk about today is just a few definitions. They're probably not necessarily anything new to you, but just to kind of level set about what we're talking about with health and racial equity, and then we'll just talk about health and racial equity and health promotion. And actually, also looking at this PowerPoint, I realized this was back in April again when we ran through this with Leo and Emma, but we would need to update this now to say CHSI, since we're no longer just the health promotion, health and racial equity team. But so this is just a few definitions. I'm sure there's many other variations of definitions for these two terms, but we just like to include them, because normally, because we've done this, presentation with other groups too, not everyone's not on the same page or at the same, what do you call it, step in the journey to understanding and learning more about health and racial equity. So we just like to include a few definitions. I don't know that I'll read them off now, but we'll get this PowerPoint to you later, also after our meeting today. So what does racial health and racial equity look like in health promotion? This is just a little bit background history about how we started. Linda, I don't know, you might remember this, but it kind of first came about. Do you remember that Unnatural Causes series that we watched?
Yeah, Liliana kind of introduced it.
Yeah. Back in the days at HSB when we were all there. So that's kind of when this first got started, I guess, as something for all of health promotion was we had some viewings of this Unnatural Causes series. I think it was actually like DVDs. And we watched them all together as a department, at least health promotion, and then kind of talked about it, what does it mean? And kind of from there, we formed this committee. So back in 2017. And I guess since we're a group of planners, we're very planful about everything. So we started off with creating a logic model, and then we thought a good place to start would be with, the staff in health promotion. Where are we at with things? Where are we at with our understanding about health and racial equity? So we put together this assessment. It's based on BARHI, which is, let's see, it's Bay Area. I have my notes here. The Bay Area Regional Health, it's very long, Bay Area Regional Health Inequities Initiative from San Francisco. So we found an assessment about health and racial equity from this BARHI group, and we basically kind of updated it to fit with health promotion. And so we did this assessment with staff. I think it was like a Survey Monkey or something, as I recall, just to kind of see where staff are at as far as capacity and skills, areas for improvement. And actually, this was before, Jackie, I don't think you would have seen this yet, but after this, public health as a department started doing health and racial equity assessments. I don't think they've done it for the last few years, but I think they're going to do one again. And I believe public health based their assessment on the one that we came up with for our team. Is that right, Liliana?
It is right. Khadija took it from us and brought it to public health, and they kind of adapted it more, and so it's taking really from our work. Yes.
Yeah. So, I mean, that's something to be proud of. So I would say overall health promotion has been kind of a leader in our wider public health department as far as like weaving in and making a focus on health and racial equity for our area. So that's just a little background. Oh, shoot. Now my PowerPoint isn't advancing. Well, I told you this would be a little bit rough. I think what I forgot, I realized I have to plug in a mouse to get it to advance. I forgot to plug my mouse in. Just a second. Yay. Okay, now it worked. Okay, so yeah, so this again, I think well, like it says here, we're in a big year of transition for this team in 2023. So as part of this, I'm realizing we'll need to update this slide. But so as it stands for the last, I don't know, 5 or 6 years, Liliana and I have been co-leading this team. And then so we aim for a representative from each of our work areas as well as from management. So for example, right now, Abby is the M team rep. And we meet monthly. And we like to say that really there's equal power at the table with this team. So really, it's not really like a top-down approach. That it's great having Abby on the team as a rep for the M team, but we really kind of all work together collectively to move things forward. So that's been a really good thing about the team. And yeah, and so then this transition period, the two big things for this year has been, like I was saying, going from just health promotion to being a health and racial equity team for all of CHSI, and then also our changes in membership this year.
Maya, if I might say one word about the
Yeah,
equal power, I
yeah,
think
yes.
what this point has been important to us is because you might not have always management that supports or believes on this work. So we wanted to make sure that the power was also among us, people that are not doing management or supervising. So in the case that something like that happens, there is still enough push from our staff, part of this team, to continue doing what is being done. And that is probably the reason why we have always stressed so much that everyone is the same at the table. We used to have Katija, we had other people that were our managers, and their voice is one vote more. It's not the last word. So that is why.
Yeah, thank you. Yep,
So
that's
you're
good.
probably going to get to it, but who will be the new co-leads?
Yeah, that and
that
yeah,
that's to be this, how they say, define.
yeah. Yes, I was thinking about that because that kind of goes with this slide. So yeah, so far, one change will be, yeah, it's been Liliana and I, obviously we're both in health promotion. So the new plan is to have one co-lead from health promotion and then one from SI or TI. Sorry about all the acronyms, but so which really would be Leo or Emma. And we did discuss that with them already, but I think we're going to talk about it more at the August um, meeting, which is our next meeting coming up. So that it would be one. Well, I guess there aren't too many new people from health promotion, so it'd be, the options would be you, Linda, Jackie, Monica, although she's not going to come on later. So I guess we haven't really discussed that. I guess that's TBD to, how that'll be decided, who would be the health promotion co-lead. But and then Liliana and I will be around for a while still too, so kind of make this a smoother transition. But yeah, it occurred to me it didn't really make sense for it to only be health promotion leading it, since now, we're part of the wider CHSI group. And we had asked too, as far as CHSI, if Karen wanted to be a part of it since she's with CHIP, but Emma's kind of repping for Karen also as part of the team. So
If I can add to Maya, in the past, when we started this work and it was all PHP, we had one representative from each area. And that was strategic because we thought that there was one person from the schools and one from the work sites and one from the community. Whatever we were learning together, that will be shared in their teams, and they will have like an expert within the team, let's say in the school team or in the worksite team, that had kind of a little more knowledge on this topic and could help that. I felt that was a really good, and it worked well for us to be strategic as we were back in that day, having someone from each team as part of this health and racial equity committee.
yeah, thanks for adding that. I think now, because I think the team's getting a little bit smaller than what it was. So I think the idea was to get kind of, it's probably not from each of the areas that we work in, but kind of a broader representation anyway on the team. Let's see. And then, yeah, so let's see. So the health promotion, has a 5-year strategic plan, although maybe we're going on the 6th year of it this year, but we're in the middle of the strategic planning process now. But anyway, so there's a health and racial equity component, of course, to that strategic plan. And then the second bullet, so this is getting at our team, our health and racial equity team. We have our own work plan. And we follow it really closely. At least Liliana and I really use it to kind of, we refer to it all the time just to kind of make sure that what's on our plan is, what's getting done and what things maybe we haven't gotten to yet or what have you. So it's usually like a co-lead thing to do is kind of keeping track of and updating that work plan throughout the year. But in any case, so being that it's a work plan, it's pretty formal. We have like these clear objectives and measurable strategies to it. And we'll give you links later where you can check out the work plan if you don't know where it is on the T drive. There's benchmarks for each of the strategies on the work plan. And we create this together as a group. So that's where the yearly health and racial equity work plan comes from, that we created as a team. And then we have ways to, and then we track like our progress on the work plan and outcomes, partly like at the end of the year. We'll go back and kind of do a rundown of what all did we finish that's on the work plan, what things didn't we do that maybe need to carry over into the next year. And it like any work plan, it's kind of a living document. So some things we realize maybe they weren't working so well, or weren't, just not really something we wanted to keep doing. So sometimes we'll take things off the work plan too. And sometimes we'll add things throughout the year, but yeah, so we're pretty planful about how things get done. And I think that really is how we keep moving the work forward, is referring all the time to our work plan. And so big thing that we do is, communications, presentations, conversations. That's a lot of what we plan with this team. Like, for example, that June 7 CHSI training. And then again, we evaluate our progress every year, and see how we did. And then, so this health and racial equity work plan that is for this team, I kind of like the way to frame this is that it really has these 3 pillars or main components we've come up with. And I'd say this has really just been through trial and error over the last, 6 years that we've been around, 6 or 7 years. It's kind of come down to 3 things. And a lot of this is really based on staff feedback too. So this isn't just coming, from those of us on the team, but based on feedback from like when we've done staff trainings, or also I think from the public health, health and racial equity assessment, the years that they've done that, we'll see what the results are for health promotion and see if there's things on there that people are asking for or what their needs are, around, working on health and racial equity. So the 3 pillars are increasing staff capacity and skills. So our staff and health promotion, actually I should say for CHSI now, so not just health promotion, increasing the use of health and racial equity best practices. So that's getting at like using some of the tools, the REIT tool, those health and all policy tools, data collection. I know we've had presentations from the SHAPE team on how to do focus groups or, what have you. And then also increasing the capacity of community partners. So how do we carry out our work for, out into the community with those that we work with around health and racial equity best practices. I think originally, when we started, we really were, I think we're focused on the last few years on increasing our capacity, because it kind of makes sense. Like we have to understand how to do these things as ourselves, maybe before we can be expected to really bring it out there to community partners. But yeah, and I think we're doing that more and more as an area, health promotion. And Liliana, I think this next slide is yours. I know we're kind of going on the fly a little bit, but does that make sense? Do you want to take it from this one?
Yes, Maya. Thank
Okay.
you. Yep, absolutely. So
sorry, and I'll keep advancing the slides if you want.
thank you. Yeah, I need that. Thank you, Maya. So as Maya said, we were kind of the pioneers within public health on this work. So initially, we were doing a lot of our own work, what we were thinking, assessment. All that was kind of the creation of our team. And as soon as this work started spreading to other areas, Then we had been working on aligning our work because we find out that also public health wanted to do their own assessment. So there was no reason to do another one for PHP. Sometimes trainings and staff were feeling like, oh, we are kind of tired, trainings from here and trainings from there. So we were like, okay, let's just figure out that we need to align now our work with the larger work happening at the county and at public health. There are tons of things happening, and honestly, I'm going to tell you it's hard to keep track of all of them within the county and within public health. We try our best. Every month, we receive updates from the health, which is managed by Leo, and Gretchen is now our representative in that team. And also, we have Kelly, who is part. Maya, what is Kelly exactly? Who is she? You know, that's kind of the thing. Who is Kelly?
Oh, yeah. Well,
representing?
speaking of transition, so I think the health equity leadership team
Yes.
for
Yeah.
public health. Kelly Harges was the rep from health promotion,
Oh.
but now I think it's Sam.
Oh,
Sam
interestingly.
just
Okay.
started,
Sam is
and then
leaving. Okay. Kelly is
yes,
leaving. Sam is getting there.
yes, and then Leo Moreno with strategic initiatives. I think he's now like the project manager of health
Health. Yes,
or
that's it.
health,
Oh,
however you
health.
pronounce
Yeah,
it.
we
Yeah.
don't know. Yeah. Great. And we also have Gretchen, which I'm not sure we might hear more, but she's part of another kind of group of people that have been trained to provide technical support when it's needed within public health. And we also have Hannah Young managing the community engagement team, which we truly believe that community engagement and health equity go hand by hand. So every month, at least with them, we try to have an update of what is happening. So Hannah sends an update to us, just read an update, and Kelly did the same. So we know what they are thinking, if they are going to do any assessment, if they are going to prepare any training. So we also kind of adjust to whatever they are doing. That's the way that we have been doing. We have also, I'm going to show you in a moment, our work plan. We have a long list of at least the teams that we think or groups that are out there within the county and public health. We really cannot keep up with all of them or know what they are doing, but at least another thing good to have is Abby. Abby many times also hears things at her level of things that might be coming. So same, we try just to adjust and not duplicate and overwhelm our own staff.
Oh,
Um,
Liliana.
Yep.
Yeah, sorry to interrupt. Yeah, I think Gretchen, I believe, is going to be the REIT champion.
That's it. You see,
I
that is.
believe, but I'm not sure where things are at with that. Oh, I had another thought. Oh yeah, and as far as trauma informed, it is nice too, since that, of
Yeah,
course, goes along with, fits closely with health and racial equity. So it's nice
equity.
to have Emma on this team too, since
Yes,
she's the TI coordinator for public health.
absolutely. And I think one of the challenges that you probably are going to face now being part of this team is to figure out who owns what, who needs to do what. We have been all this year having tons of conversations about that. For example, it seems that staff in general, CHSI, are going to need more training on the tools. But our team, and even the newer people like you, Jackie, might need the training on the tools. Though all the PHP staff from before, all of them have that training already, have done it and have been using it for a long time. So we are thinking, at least advocating, that that training should be happening from public health. That is not in our area, it's not for our team, CHSI, but it might be probably more a public health role to train everyone in these tools. That is to be determined, but I'm just kind of sharing with you that that will be some of the challenges that you as team will need to negotiate. What is truly an our is our responsibility as our team for this area specifically, and what is truly a public health responsibility. And we have not yet the answers. There is the need, as people have expressed it, and I am one that strongly believe that at least when it comes to tools, it should be a public health thing. It might be on a higher level than our team. Otherwise, you guys can be really easily overwhelmed with the amount of work that requires, because it's a lot of work. Those trainings we did it, and it requires a lot of work. So be ready to negotiate and be strong to keep trying to figure out what is really on our power and what will be on a different level. So that's it, Maya. We can move to the next one.
I was going to say, thinking too, that that's a nice reason too to have Leo on this team, because he
Yeah.
is the project manager for HELT, which is like the wider public health and racial equity team. So
For
that
all, exactly.
for
Leo
all,
oversees all public health.
yes,
Leo is the person of all public health. So it's good to have him because he also knows what should be happening for all public health, and which our team, I think, is probably not the one responsible for doing some of those trainings.
yeah. So he's reps on our CHSI health and racial equity team, and he's the project manager for the wider public health HELT team. Yeah.
Mm-hmm.
Oh, just one sec. Let's see. Oh, there we go.
So how these recommendations have been implemented in our area. And I'm going to talk from our area because really, we have been doing it longest. We have more experience. Into 2021, we have been doing a lot of the work, but there was a suggestion to create like a document that summarizes best practices. So our team created these 8 health equity recommendations. And at the end, we are going to share with you a really nice summary that Maya did for you all, where all these links are, like you can find this document here. It's really well organized, as Maya is so organized. So we will share and you will know where they are. The document was a way to kind of summarize and make easier for people to know what are the best practices that we are talking about health and racial equity, how to implement them, and what will be the indicators that we will use to know if people are using them and we are getting there. So in a moment, we can check that one. The other thing that we did is that health promotion management is the one who approves and communicates to staff. So our team suggests things. For example, we were the ones suggesting these 8 health equity recommendations, yeah. And then we brought that to our management team through Abby. Back then was Sonia or Kathy, I don't remember. They bring it to the management, and management finally said, oh yeah, we really like it. Let's implement it. And they will be the ones communicating to staff, you guys need to do this, and these are the expectations around this practice or about this document or whatever it is. That's kind of how it works, the hierarchy there. Okay, Maya, I think we can move. This is an example of one of the 8 health equity recommendations. One is to use equity tools, and those tools are in the health in all policies. Health in all policies, and I'm going to say that for, Linda, you probably have seen it. Jackie might be newer to it. There is a document that it was created at the county level. That health in all policies document was created at the county level, very much with the leadership of who used to be our manager. That is strongly Khadija, who strongly believing in racial equity. And that document has a series of tools, really cool ones. If you have not yet the chance to check, I will suggest going, checking, and playing a little bit. It has tools to create a budget with a racial equity lens. It has tools to create an event. If you are putting an event together, I mean, truly is really good. And after we review all of them, we decided that perhaps the tools that were most useful to our people, according to the work that they do, were the simple planning tool, which is tool number 2, and community engagement tool number 5. But as I said, there are many others. That is that, how do you say right? REIT, that was created by the county. So there are a series of one, and we always let people to use whatever makes more sense to them, and also to adjust or customize the tool to their needs. So it doesn't have to be every question that is there, just they can customize it. We suggest that they should use the tool when they are planning, like for example, now that we are going to start planning our ship, using one of those to plan with our partners, to plan internally, to evaluate. So it can be used in many ways. The benchmark that we decided to use to know if we are moving forward is to know how many projects during a year have been planned, implemented, or evaluating using one of those tools. And how do we know that that is happening? Because at the end of the year, all of us in PHP need to have a summary report in our kind of annual work plans of what we did. It's just a very brief thing. And we are asking people to use a different color, like blue color, to say, the worksite team said, oh, we use tool 2 when we work with our X company to decide how we were going to do the breastfeeding initiative. So they put that in blue, and then at the end, one of us go counting, okay, how many people were using the tools, how many people were doing focus groups, using any of the 8 health equity recommendations. In that way, we can compare if we are moving forward or backward, or if there are areas that we need to stress a little bit more. I'm going to share with you that, for example, this year when we review what people have been using during the past year, we saw that many people are doing now focus groups, community listening sessions, key informant interviews as a way to start the projects, which is great, is to bring the voice of the community to feed the project. That is new and it has grown exponentially. We noticed that people were using a little less the tools. So those kind of things are good to see based on that report, that kind of end of the year report that we have to do for everything. It's just not only racial equity. We just ask people to put in blue whatever they did related with racial equity. So that's the example of how the 8 health equity recommendations of best practices look like. Next, please, Maya. Positive outcomes that we have seen as a result of our health and racial equity work. Many. Based on those things that we saw, because checking every year what people are doing, we have seen how much staff capacity and skills have grown. We feel people much more comfortable talking about race and equity, using the tools, using data collection methods, the ones I just mentioned, to inform their projects, involving more communities that are affected by inequities in their projects. Certainly, the focus on racial equity has, I think, exponentially grown in our area. We have done many trainings. Many have been internal. Initially, we were doing our own trainings, which was really a lot of work because we have to do like the training and preparing everything. And then we have more support from Hennepin County. Now, Hennepin County has a really good pool of trainers that know a lot about racial equity. So what we do now is that when we do the assessment, there is an area that says training, and whatever comes very low in that, we will reach out to our larger trainers from Hennepin County and say, hey, by the way, you have any training in microaggression? So whatever thing our community PHP has asked for, we go and find the trainers now within Hennepin County. We also did a lot of trainings with the tools, as I was saying before. Almost we dedicated a whole training for each of the tools so people felt comfortable using them. We did that document with the 8 health equity recommendations of best practices, and now they are incorporated into the annual work plans. And there are many projects that have a very specific racial and equity lens. For example, the African American HIDA. HIDA is Health Equity Data Analysis. The Hmong Diabetes Prevention, which comes also from a Hmong HIDA. The Park for Diverse Communities, Active Living and Work Size, and also all the Latino community liaisons that Maya and Diane had been working for different physical activity and nutrition projects. So we have really seen a lot of changes. What are the learnings? Are so many learnings throughout these 6 years. I will say the first one was that we were able to create a shared language. When we started, everyone was in a very different level of knowledge of what equity means, what past trauma, redlining, all those things meant. And I think through all the things that we have done, the trainings, actually, I really value all those series that we watched together at the very beginning, help us level the ground, that when we were talking, people knew what we were talking about. We created like a little, we spent a lot of time as a team creating like a common definitions. When we say health equity, what we mean. When we are talking about inequities, when we are talking about social determinants of health. So what's kind of leveling that ground. The other big thing that we learned is that you have to go to staff's own pace. Sometimes we got very excited. We were strong believers of racial equity in our team, but people were like, oh, wait a minute, this is going too fast. It's too much, too many trainings. So we were like, let's slow down. Let's just listen to our own community and go slower and make sure that we are moving in the right direction. So we have to give people time to feel comfortable using tools and all the things that we are providing for them. Next, Maya. The other thing is that success requires manager and supervisor support. As much as we want that our team has a very equal power, still you need supervisors and managers that support the work. And I'm going to give you an example. We might really want for people to use the tools in their plans when they are planning ship or whatever, but if you have a manager, a supervisor that doesn't believe on that, it's not going to go anywhere. Or if you have a supervisor or manager that is not making sure that is talking to their people about what are you doing about racial equity, are you doing your trainings, kind of having that conversation is not going to go very far. So we don't have the ways to enforce to our own peers do this or do that. It has to come from manager and supervisor. So you need that support. Team membership needs to change, otherwise there is burnout. Many of us have been this in 6-7 years, so that is why we are like, oh my, really want new fresh vision, new hands, because it's tiring sometimes to be opening, kind of breaking the ice. And you also have to provide a good structure. I think part of our success has having a team, creating work plans. We meet every month. We take very seriously our annual work plan. And as Maya said before, we follow it very carefully every month. Maya and I check our work plan and make sure that we are doing what we said we were going to do. We evaluate and we keep adapting. Each time we hear from our community, and then we adapt according to that in order to generate system changes. And I strongly feel that this has been part of our success. We have been invited to give talks to other people within public health, and we see that many places are not as structured and organized as our area has been. So I feel it helps a lot. Next, Maya, please. And this is the beautiful document that Maya created. So for more information on the onboarding, Maya created a document that has the membership and kind of the roles for everyone in the team. It has the time commitment, meeting frequency, roles and responsibilities, the leadership structure, what are the roles of the co-chairs, and also had links to important documents like agendas, meeting minutes, toolkits, work plans, the health equity recommendations, and the logic model. So if you want to dig a little bit more, then you will have that there. So next one, and we will send you that link too. We may make sure that you have it. And I think with that, we end. And you might still have a lot of questions. Just feel free to jump. And I will say like roles, just kind of big level. As a co-chair, you have certainly much more responsibility. And if any of you gets chosen to be the co-chair, please feel free to reach out to Maya and I will be more than happy to give more detailed information on what it means to be a co-chair. Maya and I meet at least once more a month. So it will be like 2 meetings, one with the whole team, one ourselves, usually to our team. So we prepare the agenda. Maya has been so kind to take minutes through all these years. We are going to change that to have more like a rotation because it's a lot of work. But we create the agenda together, we read together the minutes, and based on that, we decide how the agenda is going to be, who is going to lead what. We are also a working team, which means everyone will have responsibilities within the team. It's not only Maya and I. It's certainly heavier in the co-chairs, but those of you that are part of the team, let's go how it was last week in the onboarding that we did for last month with the CHSI. Kathy Ruth had a piece. Remember how she kind of guided us to dividing us in teams. All of us had a role, and usually what we do is whoever gets assigned a role, they will do it from beginning to end. They will do the planning, they will do the materials, they will do the evaluation, and they will let us know if they need help from anyone. So that has helped us a lot too. have balance and not get too overwhelmed. But it's always we decide that we need to figure out a training. So then Ruth and someone else might take that task and go and find and bring it back to the team, and then the team decides together. The roles are divided, but as a team, we always decide together as a team. So there are months that truly, if you are only a member, will be easier months. Not all the time we are busy, like doing something, but the chair and the co-chairs, yes, do have much more work. So that's kind of big level roles and responsibilities. Now, please feel free to ask.
I know we went through a lot.
Yes.
So it's kind of a little bit old school to think about people doing the work separately, but I was thinking about this book from Kamau Bell about doing the work, anti-racism. And has there been discussion about times when it makes sense for BIPOC people to meet separately to talk about the issue versus white people doing the work? Has there been any discussion of that?
Well, we usually leave our people decide that, Linda. Like it's not the opposite. We base our work plan on what we hear from our team. When I mean team PHP, now knowing that is SI, so we kind of need to figure out what they want, but it's not the other way around. So far, no one. Well, I guess for a long time I was probably the only person of color. Let's starting with that. And then it's just
Yeah.
recently, probably in the past year, that we have more people of color. But so far, we have not heard that as a need from them. So we are always waiting for them, for our community to tell us what they need, and then we jump.
Did you hear some of it though at the culture meeting this week? I mean, about microaggressions and, it's more personal to me all the time. It seems like I heard a need for 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 potentially for white people to take a look at where they're speaking from a place of privilege, that they can say, oh, don't take it personally. This work isn't about you. I mean, I heard a little bit of a need for people to sort of be called in on some of that.
And I think that will be something that will be need to be sought with our own team. And again, they will be the one who need to decide if they feel that that is or not a problem for them. What I think I understood in that meeting was more that sometimes you as a person of color just cannot remove from an issue. Like let's say COVID. I'm going to give the example of COVID. That is what I understood. When I was part of the COVID team, um, it was just not COVID. I am part of the Latino community, which is probably one of the communities that suffered the most, with a lot of people dying and getting sick. So at the end of the day, I just don't go home and I said, okay, I just close my computer and there is COVID. I am still part of a community. My friends are suffering, family members, so it's that kind of thing that I just cannot. I feel that is what people were saying this week. Still, it can be explored, but I feel the beauty that this thing has had is that we never say anything to people. We always hear from them, and from them we do. And I feel is that centering on their needs, no on what we think. At some point, they might come and say, we are feeling microaggressions here and all that. And then it will be up to this team to decide how they want to respond. But I feel so far it has not been the other way around.
Thank you. I just was curious about the history.
Mm-hmm.
No, it's a really good question. And I think we didn't get a whole lot of response from the evaluation for that June 7 meeting. I think we only got 2 responses, but I think there was some good information there. And we always look at that feedback,
Yes.
from those trainings or what have you that we do. But that might be something interesting to explore, Linda, for the coming year. And it's not to say the team, since it's going to be changing a lot, has to do things the same way we've been doing them.
Absolutely. And I feel, Maya, and you please correct me. I feel that so far the work has been less personal, and it's okay because, as I said, you take people from where they are, and it feels sometimes easier to do things like we have the tools, we know how to use them, so it's like. And then probably at some point we did have some in the last assessment that the county did, public health did, some of the requests that came from that, but of course COVID came and changed everything, the pandemic. Some of the things that we heard is that, supervisors and managers were not, people felt that they were not comfortable talking about race and racism. For example, that came, and we had it as one of our things to kind of consider with more detail. And then the pandemic came, and so, but also it has changed a lot. We don't have the same supervisor, we don't have the same managers. So I think it will be wise to see what comes out of the next assessment that public health does, and based on that, if that is still an issue, then try to address that situation.
Yeah, and I don't want to like talk around it, but I did like from my experience of using the right tool and the other tools, sometimes there was an attitude of we have to do this versus, which isn't the intention that I think that we and so it's like check the box kind of attitude, and that's what you're sort of saying, that we need that support from at all levels, and that is where I think there needs to be a calling in of this is everybody's issue.
Absolutely.
And okay, that's just, I don't want to sort of
and
allude to
even if
something.
you have to, I am okay with that, because that's a step, right? Even if you feel it's because I have to,
Right.
that is progress. Because in the past it was just like if I want or not, and many people were like, I don't even see it, right? I don't even feel the need. So I think this is a work that requires tremendous amount of patience, racial equity, because we have built systems in many years that if we want to change, it's going to take many years to. I talk a lot with my partners that I'm working with, community partners on racial equity. It takes a lot of time. It takes a lot of patience, and we want people engaged. Because if we push too much, people are going to start hating us and not wanting to do, they can go to the other corner. So I feel that enough stick and carrot, what I mean? You still have to do it, but here are the reasons. And many times I think after people start talking more with the community, they can see there are good reasons behind.
Mm-mm.
Yeah.
Thank you.
I found it. Oh, Linda, go ahead.
I was going to stop the recording, but go ahead. We're getting close to the end.
Yeah.
Yeah, I find it interesting to be a part of this team where the HRE team itself is diverse. And I have in mind that some people have way more awareness and education about racial equity than others will on the team itself. So it's interesting to me because there was no application, so to speak, or I don't know how the selection was made, or maybe it was just like out of trading it off, whatever it might be. I'm aware also, as someone who's going to be part of giving information to our internal team and getting it from the community, that I do think that there are different levels of awareness when it comes to racial equity. And that's important to be mindful of on this team. But also, going back to what Linda said about our cultural team meeting the other day, was it yesterday?
Tuesday. I don't know
whenever
what day is it today.
Time is a river. But I heard both.
Yeah.
Like Liliana, I heard what you were describing, but I also did, Linda, hear what you said. And so I think that to no one's fault, but just to their exposure and level of education around this stuff, and like maybe even generation, there are different levels of awareness, acceptance, and resistance about this topic itself. And I witnessed it even in our public health promotion meeting the other day. And so I'll be curious, and really, I think it's important for this group, especially since there's such a big transition happening, to be aware of our own shortcomings and to hold each other accountable for our blind spots. Because, I'll just call it out. Like I am, my experience is more as a white woman, and Liliana, I've already learned so much from you talking about your work with physical activity outdoors and how it affects the Latino community. And that's one really specific example, but it's like I definitely have ignorance about things, and I want to be the best, carry strength on this team too.
Jackie, that's so beautiful.
Well, I want to be aware of that, because if we're gonna, this
Yes.
is a leadership team, I think, and we
Yes.
are the holders of information. And so if we're gonna be taking that from the community or like distilling it and also taking it back into our work community, there's a responsibility with that, and not everybody is as educated as others.
And Jackie, you know what? Number one, thank you for being so sincere and to be allowing to be vulnerable. I feel that is the number one thing, to recognize. Even for me as a person of color, I don't know anyone's histories. I cannot even try to go into the Native American or the African American trauma, because even my way of, number one, a Latina, number one, I didn't grow up here, so I didn't have to go through a lot of the pains that many people of color, even from my own community, had to go. Gives me a completely different perspective. And I feel what you just said is beautiful, because it's just starting the right place when we know we don't hold the truth, we don't know everything, and we are here to learn together. Honestly speaking, we did so much learning together. When we started this team, none of us knew anything. We were just reading a lot. We were trying to figure out how we are going to do this. And as a team, we grew up and we gave each other a space, and we talk about blind spots in such a beautiful and respectful way. I always felt this was a very safe space. I don't know, Maya, you might give your own perspective as a white woman, but I always felt that it was beauty and respect and a lot of space for us to learn from each other. And all the time, we started noticing that we were getting better and better. And I have to say that the white allies that I have in this team are unbelievable. They sometimes are the one who start saying stuff that are like, oh man, wow, this was excellent. So yes, you have a space in this team. You're starting in a very good place, recognizing your own vulnerability on it, and there will be tons of space for you to grow. And it's up to you all to keep that space respectful and beautiful as it has been so far. I always have felt respected. It's a happy place. I come happy to these team meetings, and we learn together a lot, a lot.
Hopefully it's just a quick question because we're at time here, but was there any discussion of the land acknowledgement?
No, because it's
never-
not our. Remember, we are always saying what is really in our realm.
Okay.
What is our realm? I think land acknowledgement was something that happened more at the county level. It kind of what is the power? What is our influence? What is our level of influence? It was more a county conversation, but it never had been brought up from a need from our team. So I think we keep centering everything in the need, in the team needs.
I totally agree with you, what you're saying, but we hold trainings, and when we don't do it, it's becoming kind of apparent that we're outliers. So I'm bringing it up as a need, as like I've had it on the agenda for our team for a while, but there hasn't been, it's like, we'll just wait to see what the county says and stuff like this. So we are being led by other people who, so I'm just throwing it on here so everybody can hear that. I have seen it as a place where it gives an opportunity for people to say, how far behind are we going to be? Like, are we going to wait for like 3 years before we catch up, or are we? And same, just sort of like, I totally agree. I'm absolutely in bottom up, but I don't know that I was asked, or, because that would have been an issue that I would have given to whoever was the representative from my group. So if it didn't come to the team, that tells me that, perhaps we need to, even at the trainings that we do, leave time in the trainings to get people's evaluations and ask them, what do you see is lacking, or what do you want training on, or where do you see us in 5 years? I don't know.
Yeah, you can certainly ask people. I feel, as I said before, the rhythm is based on our community, not the other side, not the other way around. There were many ways that we as a team wanted things. Like for us, it will be required that everyone has to do already use one of. So far, it's not required. So far, but still we see people using, like, the tools are not required right now, like the health equity recommendations. But slowly we are seeing that even without being a requirement, people are doing it. So I feel it's always keeping a pulse of your community. What is that they want? If they are not yet ready for that, if they don't want it, it will need to go and rest. And we will need to be okay with letting it go. You know what I mean?
When you say our community, do we mean the end users, or we mean the staff people?
Our PHP, because our service is our team, and whatever they do, the structure that we are providing is a structure for them to be able to work They don't work. Remember, we have the 3 pillars. So
pillars,
everything
yeah,
is based.
with that.
2 of them are internal. Is
Right.
you have the capacity, you have the skills, and you have the tools to do it. And then you have the third one that is working with community partners. So our target audience is here, is this group, our
Yeah.
PHP and SI now.
Yeah, so I guess that's where I was talking about that third pillar of where are we leading the community? What are the elements where, just bringing up health equity, but where are we kind of staying in touch with?
And where they want to go. Remember, it's always not about us. It's about our community. Where do you guys want to go?
Yeah.
Let's go.
Yeah,
It's
well,
that leadership that is voice-based, people, community-based. This is our community.
I was going to say that the idea about the land acknowledgement, that's actually kind of interesting. Yeah, that had not come up. I don't think anyone had brought it up to the team, but that's another thing. Keep that in mind moving forward. Maybe for 2024, if not, we've got a lot of changes going on now, but it'd be interesting since Leo kind of reps for the wider public health. It might be an interesting conversation with him. I don't know if HELT has talked about this, but yeah, that's again where we kind of bump up against. There's the county is so huge and there's so many layers. So as far as I understand that land acknowledgement, I think it was a board, is it proclamation or something, or it went before the board.
Yeah.
So it's definitely county level, but no, I haven't heard a whole lot about it recently. You're right. I haven't really heard it said before trainings, like wider county trainings.
It's true. I think I only had heard in the board in just recently, because I was listening to Amy that just left. I was listening to her presentation, and I noticed that they did the land acknowledgement, but far beyond that, I have really not heard any.
I didn't hear that part of the, I must not have watched that part of that recording. I just saw that too. Yeah. So I think it takes a while, I'm guessing, as the county takes a while for things to kind of really get entrenched, and maybe did that just get started this last year?
I think it was like during the pandemic, at the most 2 years ago, that they work on that land acknowledgement.
Yeah, there was some gathering around it as well that I missed because of scheduling, but
cool.
Yeah.
Well, thank you all. This is really helpful.
No, and thank you for joining us.
Yeah, we appreciate it. I know we went over a lot. I'm going to update the PowerPoint